It's 2025 and insurance just keeps getting worse. I just did 2 bilateral deeps and 2 bilateral tissue expanders for patients. And I've never had this happen before, but during the second deep, I got a phone call into the operating room saying that UnitedHealthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery. And, said I had to call right now. So I scrubbed out of my case and I called UnitedHealthcare, and the gentleman said he needed some information about her, wanted to know her diagnosis and whether her inpatient stay should be justified. And I was like, do you understand that she's asleep right now and she has breast cancer? And the gentleman said, actually, I don't. That's a different department that would know that information. And I was like, well, she does need to stay overnight tonight. And you have all the information with you because I got approval for this surgery. And I need to go back and be with my patient now. But yeah, it's out of control. Insurance is out of control.
You just heard from Dr. Elisabeth Potter, who shared her experience on Instagram to give us all a sense of how bad our healthcare system is from a doctor's perspective. And to be fair to the insurance agent who called her, he obviously had no idea that she was already in the middle of surgery for the patient in question. But the fact that insurance companies expect surgeons who could be in the middle of surgery at any time to call them back immediately so that way they can justify the care that they say their patient needs is truly insane. And it doesn't seem like the surgery itself was the issue. It seemed like United Health didn't really want to pay for the overnight stay, but it was already recommended by the doctor. So that should be the end of it. There should be no question about whether or not it's covered. The insurance company shouldn't be able to dictate what type of care is or isn't necessary because they have no expertise in that regard. So if a doctor says that the patient needs a certain type of care, the insurance company needs to shut up and pay for it. And the fact that that isn't how our system works gives you a sense of how rotten it is. But my first thought when I saw this was, why didn't she just ignore them and not call them back? Because even though another doctor was there to keep the procedure going, stopping mid-surgery to take a phone call is a lot of work. You have to scrub out, and then you have to scrub in again, and it's actually a really long and meticulous process, and I'll link you to a video of a doctor explaining it below in painstaking detail just so you're able to grasp what that insurance agent was expecting of Dr. Potter. But in a follow-up video, Dr. Potter explains why she felt like she couldn't ignore the insurance company and had to stop mid-surgery to take the call.
It's gotten ridiculous that insurance companies really do control when and what kind of care we deliver. And it's almost like a fear-based system where if an insurance company calls me and says I got to call them right back, like I'm afraid they're not going to pay for my patient's surgery, that patient's going to get stuck with a bill.
And to her point, if a patient is stuck with a bill, it's almost certainly going to be tens of thousands of dollars. So that bill could ruin her patient's life. But her describing it as a fear-based system is so on point because, a surgeon shouldn't have to think about anything but the surgery. In fact, that's all we want them thinking about when they're doing the surgery on us. But the fact that they have to be ready at all times to take a phone call from a health insurance company, that just tells you how despicable our system is, right? Because if she doesn't take that call, she's worried her patient's life will be ruined when she wakes up. That is so disgusting. Now, in the aftermath of the assassination of the UnitedHealthcare CEO and then the subsequent response from the public to that, where they basically supported it, United Health's shareholders have seemingly realized that maybe they were a little bit too greedy, at least publicly. And I say this because, as Joseph Choi of The Hill reports, shareholders of United Health Group are calling on the company's board of directors to release a report on how its policy of limiting or delaying access to healthcare may be impacting the company's brand and the economy overall. In a supporting statement, the shareholders said UHG policies that cause delayed or avoided medical care threaten both the company brand name as well as its investors' portfolios by increasing consumer debt, jeopardizing health of policyholders, and thereby reducing workforce productivity, straining government resources, and risking increased taxes. I found this funny because let's assume for a moment that the board of directors complies and releases the report and it confirms that the company is indeed profiting off of the suffering of sick Americans. Then what? Are we supposed to expect them to self-regulate or change their business practices? That's not going to happen. They're handling this as if it's a PR crisis and not a policy crisis. But the real solution is that companies like United Health must go the way of the dodo. All of them. Sorry, shareholders, you might not want to hear that, but it's not particular practices causing harm. It's the entire fucking business model. And just to put things into perspective, this is the only developed country that has a healthcare system like this. If you're British or Canadian, sure, there are issues with your system, but you get the care that your doctor recommends, period, no questions asked. And that's because they've mostly decommodified their healthcare systems. Healthcare to them is free at the point of service, and the goal isn't profits, it's care. Because those governments realized at some point that taking care of citizens and providing them with basic healthcare is the most minimum expectation of any functioning government. But our government hasn't made that same assessment. And the reason why it's so bad in America is because we've turned healthcare into a money-making venture for corporations, which is extremely perverted because healthcare should not be about making money. It shouldn't be a business. It should be about care. And when you create an entire system based on profits, the incentive to make money conflicts with the goal of caring for patients. I mean, imagine if your house was on fire and you called the fire department, but before they could put out the fire or rescue anyone in the building, they had to call to check with your insurance company to make sure that it was covered. That would be insane, right? Yet, when it comes to healthcare, that is basically the way that our system functions, and lawmakers pretend like that's perfectly normal when it's not. And this story is one of many that demonstrates how bad it is. In fact, the Loan Institute just released the 8th annual Shkreli Awards this week to highlight the worst healthcare profiteers in the industry, and I just want to share some of the worst offenders, courtesy of Brett Wilkins of Common Dreams. Insurance giant Cigna is under fire for billing a family nearly $100,000 for an infant's medevac flight. Jesus Christ. 7 suppliers allegedly ran a multi-billion-dollar urinary catheter billing scam that affected hundreds of thousands of Medicare patients. Memorial Medical Center in Las Cruces, New Mexico allegedly refused cancer treatment to patients or demanding upfront payments, even from those with insurance. This is a reminder, by the way, that hospitals are also part of the problem too. Pharma giant Amgen was accused of pushing 960 milligram doses of its highly toxic cancer drug, Lumacrus, when a lower 240 milligram dose offers similar efficacy with reduced toxicity, but costs $180,000 less per patient annually at the lower dose. My God, they are so evil. Now, of course, our friends at UnitedHealth made the list too. UnitedHealth allegedly exploited its vast physician network to maximize profits, often at the expense of patients and clinicians, including by pressuring doctors to reduce time with patients and to practice aggressive medical coding tactics that make patients seem as sick as possible in order to earn higher reimbursements from the federal government. More on that later. And finally, Steward Healthcare CEO Dr. Ralph De La Torre was accused of orchestrating a dramatic healthcare debacle by prioritizing private equity profits over patient care, surprise, surprise, amid debt and sale leaseback schemes and a bankruptcy that left hospitals gutted, employees laid off, and communities underserved as he reportedly walked away with more than $250 million over the last 4 years as hospitals tanked. And these kinds of stories are inevitable when your entire healthcare system prioritizes profits over people. And I've said this before, I'm going to say it again because it's important. Healthcare must be free at the point of service. A single-payer Medicare For All type system would cut costs, but more importantly, it would save lives, specifically 68,000 lives per year, according to a pre-COVID study, and that's a more conservative estimate. But politicians in both parties pretend studies like that don't exist because they've been bankrolled by for-profit health insurance companies that profit off of our sickness. And sure, Republicans have no plan whatsoever to fix the system, but Democrats don't really want to fix the system either. I mean, sure, they'll make some tweaks around the edges, but remember when Bernie Sanders ran on Medicare For All back in 2016 and 2020? You saw all of his primaries essentially delegitimize Medicare For All in order to sell us a more incremental solution that would apparently get us on the track to Medicare For All, but would conveniently let the health insurance companies that are taking advantage of us continue to exist. Why? Because they were bankrolling those politicians. But I say, fuck that. It's 2025, and we need to stop listening to politicians that promise to put us on a track or path to Medicare for All with some incremental approach. We just need Medicare for All now. And if we're lucky enough to have another election again, don't you dare support any Democrat in the next primary that doesn't full-throatedly support Medicare for All. But with that being said, while Republicans don't have a plan to fix our broken healthcare system, since the Affordable Care Act basically was their plan, don't assume that they're not thinking about healthcare reform at all, because they are. They don't want to make it better, even incrementally. They want to make it worse. And the way that they want to do that is by privatizing existing programs that are already successful, like Medicare. And the way that they're doing this is by increasing the prominence of Medicare Advantage plans, which weren't created until 1997. Now, if you're unfamiliar with Medicare Advantage, it is basically one big scam. If you're old enough to qualify for Medicare, you should buy Medicare Plus a supplement, not Medicare Advantage. And Timothy Noah of the New Republic explains why. Medicare Advantage looks to people over 65 like a better deal because it covers things traditional Medicare doesn't, such as visits to the dentist or the eye doctor. Some plans even cover acupuncture. But if you get seriously ill and need to be referred to a specialist, Medicare Advantage isn't so great. An April 2022 study by the Health and Human Services Department's Inspector General found that 13% of the referrals denied under Medicare Advantage would have been approved under traditional Medicare. Medicare Advantage also shows that healthcare privatization is a lousy deal for taxpayers. Medicare Advantage costs the federal government 7% more per enrollee than traditional Medicare, according to an August 2024 study by the fiscally conservative Peter G. Peterson Foundation. For enrollees with similar health profiles, Medicare Advantage costs 22% more, according to the Medicare Payment Advisory Commission. Perhaps that's because, as the journal's investigations found, Medicare Advantage insurers routinely pad their government reimbursement requests with spurious diagnoses. For example, an astounding 66,000 Medicare Advantage patients were diagnosed with diabetic cataracts even after these patients had surgery to correct them, making that diagnosis, in the journal's words, anatomically impossible. UnitedHealth, the parent company of UnitedHealthcare, whose chief executive, Brian Thompson, was assassinated last month, is, according to the journal, a particular offender, furnishing doctors with checklists of possible diagnoses. Looking at Medicare data between 2019 and 2022, the journal found that patients who moved from traditional Medicare to UnitedHealth's Medicare Advantage plans got 55% sicker on paper during their first year in Medicare Advantage. But spoiler alert, they weren't actually sick. UnitedHealth was saying that they were sicker so they can charge the federal government more. So UnitedHealth, who is the largest recipient of Medicaid Advantage, by the way, is effectively defrauding the federal government. And nobody in power really wants to do much about this because these insurance giants lobby government officials and politicians to be complacent, or, they donate to their campaigns. So you don't want that gravy train to stop. So you just let them take advantage of all of us and defraud the system. So we're kind of stuck with this system where companies like UnitedHealth will say that their Medicare Advantage patients are sicker than they actually are, so that way they can bill the government more. But when it comes to patients on their regular private plans, they then say that they're healthier than they are, so they can deny them coverage. And that right there demonstrates clearly why private insurance can't coexist with public plans, which is what a public option would be, which is a popular alternative to Medicare for All that we hear from politicians. Because in theory, a public option sounds good because it would force private companies to compete with the plan offered by the government, and that plan would obviously be cheaper and more robust, but that will inevitably lead to private companies pushing all sick people onto the public plan, so it's overburdened and underfunded. And once they break that system after enough lobbying and whatnot, they then swoop in like heroes to offer supplemental plans to milk even more money out of us. So even though a public option would be better, a step up from where we're at right now, we just need Medicare for All. We don't need to form some building block or path towards Medicare for All. We just need Medicare for All. Private insurance should not be a thing in healthcare. Even in countries with single-payer or national health systems, private insurance is becoming increasingly prominent, and it's making their public systems worse. But Trump's ultimate goal is to make Medicare Advantage even more prominent. And I say this because in Project 2025, one of these stated goals was to make Medicare Advantage the default as opposed to an option. And Trump nominated Mehmet Oz to lead the Center for Medicare and Medicaid Services. And guess what? He's not too keen on Medicare. In fact, Dr. Oz has called for a massive expansion of Medicaid Advantage, the program that is defrauding the federal government. And he coincidentally happens to have over $500,000 in stake in UnitedHealth. which again is the biggest beneficiary of Medicare Advantage plans. So that conflict of interest might have something to do with his position. But that's our system. It's corrupt, isn't it? It doesn't have to be this way, though. The solution is simple. We need to improve Medicare. Then once we improve it, we expand it to everyone, and we ban private insurance companies so none of us will have to even think about healthcare again for the rest of our lives. The problem is that even though the solution is simple, there's a lack of political will to implement that common sense solution because corporations and policymakers, they would rather us suffer so that way corporations can make money off of us. Not to mention, their stock portfolios are really fat because of these health insurance companies. So in the meantime, until we get a better system, I guess that they all benefit while we all suffer. It's just truly sad, but that's the way it is.